Hey, good morning, everybody. This is Rob Kusserow with Well Health. Thank you for joining us this morning. We're going to give everybody just another minute or two, and then we will get going. All right, we're a couple minutes after, so let's get going. First of all, thank you everybody for joining. Appreciate your time. I know you're all very, very busy, so I'm very grateful for you joining us today. So this is going to be an informational and instructional video webinar to share best practices for patient messaging around the COVID-19 outbreak. It's really intended for anyone that has influence over any type of patient messaging. It doesn't really matter what system you're using to message patients. Really, we're here to give you ideas and language that you can use, hopefully to reduce the burden on your staff and provide patients with the most up-to-date instructions as the situation continues to evolve and change. So again, my name is Rob Kusserow. I'm Director of Client Success here at Well Health, and with me on the webinar today is Paul Ringer. He's Manager of Client Success, and then Emma Kaplan, Client Success Associate. Paul, Emma, good morning.
Good morning, Rob. Glad to be here. Thanks everyone for tuning in.
All right, thanks for being here, guys. Agenda. So what are we going to cover today? Really what we're going to focus on is what we've seen in terms of that increased burden on our health system partners, and then how the clients are responding. Messaging on that anyone can implement, again, whether you're using Well or not. And then we're going to dive a little into more detail into our tools. So Well communication tools such as campaigns, broadcasts, automations, internal mentions. So those of you that are currently using Well, you're familiar with those. And then those of you that may not be, that are just tuning in from a very high level, campaigns, just it's a way to reach really all patients, an entire patient population. Whereas a broadcast is more targeted. So we're going to be talking about how to target specific patient populations. And then automations are really just kind of ongoing information that can be updated as needed. So we'll give you examples of those. We'll give you examples of what type of messaging delivers the greatest response from patients, at least that we've seen. And then also, please note, attached in this GoToWebinar, there's a few handouts that we've attached for your convenience. So be sure to take a look at those. And then we'll wrap up with Q&A at the end.
Yeah, and a quick note there, just on the Q&A, feel free to type in any questions that you may have along the way. We've got a team ready to answer any questions that you may have, and also at the end, we'll take a minute for any other questions that we can help answer to the broad group.
Yes, thank you, Paul. Well, this is that, and that's a really good point. So this, while we've got a lot of information to share, we want this to be, you know, your webinar. So as you have questions along the way, again, please feel free to jump in. We'll answer as many as we can during this webinar, and just know that any that we may not be able to get to during the call, we will have our team responding. Our attempt will be to do that, to respond to everybody by the end of the day. All right, so what are we seeing? So what we've seen is really a lot, especially the last few days, right? So health systems, we're seeing these COVID cabanas, I'm seeing them called. I know some of the health systems I personally work with are putting up tents in parking lots, in parking structures. I live in Orlando. I've got some friends that work in the health systems here in town, and they're actually in the ER setting up tents inside the ER, which I thought was interesting. We're seeing drive-through testing centers being deployed throughout the country. A lot of health systems at this point are really trying to limit or cancel non-essential patient appointments. So a lot of communication going out around that. A lot of focus on telehealth and virtual medicine, as we've all seen. And then really as this is evolving, we're seeing more and more about social distancing, some more and more communities starting to shelter in place or talking about sheltering in place. And then of course, a focus on protecting our healthcare workers. So I wanted to share this slide. So this is really the last 2 weeks, and this is a visual of outbound messaging from our combined health system partners, very specifically outbound messaging that has either contained the word COVID, coronavirus, or fever. And I think the reason this is so important is one of the things that the first response from health systems was to dive into campaigns. So the first thought was, let's message every patient that's ever seen us all at once and get a message out. So that's why you see a big spike around the 5th. March 11th, you see we sent out over 200,000 messages just on COVID-19 alone. As things progressed, I think health systems started to realize that this is ever changing. I mean, it's not even day to day, it's sometimes hour by hour if you're watching the news. And so what we've seen is a shift from that campaign type of a message more to automations and broadcasts. So what that looks like is rather than sending every patient a message all at once, we're seeing health systems set up messaging that might go out to a message that goes out to any patient that has an appointment within 24 hours. So that's an automation. Because there's a little bit of a gap between when you implement that automation and when it actually starts to kick in. Health systems are using a broadcast as kind of a stopgap to fill that in. So if you're not familiar with WELL, let me give you a little background, a little more information. So I'm using the word campaigns, broadcasts, and automations a lot. So I thought it'd be good to show you what does that look like outside of today's environment. So 3 weeks ago, what did this look like? How are health systems using these on a day-to-day basis? So campaigns where we see people using campaigns a lot would be things like annual flu shots. Again, you want to just message everybody. You can target a little bit. Campaigns might also be used for back to school physicals to bring in a specific population. And the way we manage that is just a targeted set of MRNs that are uploaded and we send out that message. Broadcasts, a little bit more targeted. Typically that is going to be again for, typically we see it schedule based or location based or a combination of that. So again, I think I said earlier, we had a health system that had a pipe break, and so it was a very large health system, and they only wanted to target patients that were coming in that day to one specific office. So that's a great example of a broadcast. And automations. There's a couple of ways to use automations and 3 ways that health systems typically use those. We talked a little bit about an outbound automation earlier, and so that's just example would be an appointment reminder. To a patient, you've got an appointment tomorrow, are you coming in, yes or no type of a situation. Then we can make them interactive. So let's say it's a specific event type that requires no food or water after midnight. So we can set those up so that, you know, ask the patient, are they coming, yes or no? Patient says, yes, I am coming. And then based upon that information, we might send them a reminder the night before to not have food or water. There's also one other type of automation. It's an inbound keyword automation. So an example of that would be, we set up certain words that we're looking for. One might be directions. We see that a lot, where a patient may text in, hey, I need directions. And as an automated response, we can go ahead and have that set up so that we can send the address and maybe a map link. So how we're seeing this transition in today's environment, again, we talked about campaigns a little bit, and that was that first reaction that health systems used. We've really seen them move away from campaigns, but I do think that that is still a great tool, because where I think we're going to see that going forward is as we start to see specific offices that might have to close and redirect patients somewhere else, that campaign would be a great tool to do that. So if an entire office is closing, we could do that. Another example might be if the office tries to drive all of the patients to do or non-essential appointments, either to cancel or to move to virtual care. That might be another option for a campaign.
Yeah, Rob, and I'm starting to hear that from even family, friends, some groups that I'm working with, places that are, unfortunately having to close their doors just to help out with managing social distancing. But, on the flip side, also, I've seen some organizations using this now to let people know that, they still are open. And, if they're displaying any of these symptoms, please get in contact with us so we can best aid you as a patient. So just one of the cool ways that folks are using kind of both flip sides of what's happening right now with this pandemic to really use campaigns to reach out to a broad audience of patients.
Yeah, absolutely. And then I think I agree with you. In the broadcast, I'm actually seeing a lot of people use broadcasts to ask about fevers because the broadcasts, for instance, I've got one health system that has sent out a broadcast for all patients today or tomorrow, asking if they have a fever. If they do, asking them to please call the office or reschedule. So that's a great way to communicate with patients when you've got kind of hot information, something that's pressing that you need an immediate answer for. And then as far as the automations go, we're seeing a lot of health systems actually set up a general automation that says, if you're experiencing, fever, shortness of breath, please call us before you come in. And actually, a probably better example of the broadcast is one we sent out yesterday. Was a health system was finding that they were from the automation that's going out about 4 hours to 24 hours before an appointment is saying, hey, if you have any of these symptoms, please call us before you come in. And as a result, they were finding a lot of patients were proactively canceling their appointment. So the health system went back and sent a series of broadcasts out to patients that have appointments in the coming week, basically asking them if they want to go ahead and cancel that appointment or reschedule that appointment to try to go ahead and capture the folks that were going to be canceling. And they had a very positive and a very large response from that. So this slide is just kind of giving you an example of what does this look like when we personalize it. Some examples here of kind of specific language, what it looks like. We go through, so campaigns and broadcasts can kind of look the same on the messaging, but the only difference there is how big of a reach do you want to go with that with the audience. Appointment automations. Yeah, again, so here's an example. This is something going out probably 24 hours in advance, just reminding the patient they've got an appointment. If they have a fever, please let us know. And then also an example, you could start driving people to telehealth if you wanted to here. And then here's an example of a keyword automation. So where we're really trying to elicit a response from that patient. So hopefully that, if they've got fever or if they have any symptoms, they think of COVID-19, they can respond. And then that keyword automation is going to grab that specific word and then trigger a response based upon what we're looking to do. And just so you know, we've got some examples of these in the white paper. And again, those are attached so you can download those.
And hey, Rob, we do have a question that just came in that I'd like to bring up because I think it'll help out.
Okay.
So one of our audience members is just asking, they need some help engaging with the Spanish speaking community and are wondering like how within Well, they can reach out to patients with these different languages.
Great question. I think, what's our next slide here? I think we might have that on our next slide. No, one of the upcoming slides I know talks about that a little bit, but so we have the ability to actually do language translations in our system. We actually capture 19 of the most common languages that we can very quickly and easily do translations with. So Spanish, Mandarin, French, and Korean. Specifically when it comes to the Spanish-speaking community, one of the things we'd recommend is actually creating the automations, campaigns, whatever, with a Spanish translation as well. And as long as the EMR has, without getting too deep into it, but if as long as we're receiving the information of a patient preferred language, the messaging will go out in that correct language. A couple of things you want to keep in mind there are you want to make sure that you actually have somebody that is fluent in that language, just to double check and make sure the translation looks accurate. It's usually very, very close, if not perfect, but always good to just kind of sign off on that. And then of course, just make sure you've got someone at the ready that can respond if you do have someone respond in Spanish or whatever language it may be.
Great, thank you, Robin. And to your point, I think we do have some slides later on that will cover more of some of the specific setup, just so that you all listening in right now can kind of see what that looks like within Well specifically.
Yeah, and I think actually, Paul, were you the one that sent in this particular campaign? I think you had a little information on this. Do you want to talk to the slide?
Yeah, so here at Well, we have been just monitoring to see what are the most effective messages that our organizations are using to really reach out to their patients and what's getting like the best kind of response. So one thing that we are tracking and trying to dig into is a metric called click-through rate. So basically we can tell when a message is sent out with a link in it, how many of your patients are actually clicking on that link. So we wanted to just provide a strong example where we saw a really good click-through rate. So some key things to keep in mind with the language is one, keep it short and straightforward. The longer message that you send, the more likely you are to lose your audience. Make sure you identify yourself, especially early in the message, so that people know that it is the healthcare provider reaching out to them. And then make sure to have a strong call to action within that message, so that there's something that the patient can specifically do. So here we provided an example of that message. So it would be Get Well Medical Group has an important announcement to share with you regarding our response to the coronavirus pandemic, COVID-19. Please tap on the link to view the announcement, and then a link was provided. And we saw that 60% of the people that were sent this specific message with that link actually clicked on the link to view what this organization had to say. So I think on the flip side, now on the screen, we've got an example that, we've seen some organizations sending out very long messages, started off with, all capital letters, important message from, or just like some vague language or just like overly long. We're finding that, the longer and kind of more of these things you can do, it can either be interpreted as spam or you're going to lose your patients about halfway through before they even see like what the call to action is. And, in this case, it would be clicking on a link to get more information. So I'm not going to read off this whole long message, but I hope this like kind of helps portray the point of, it's very effective when you keep it short, simple, and a very specific ask to the patients and identify yourself early. And make sure to avoid things that could be interpreted by spam or using vague language or just including too much. Again, this is a text message, so you don't want to send a paragraph. Keep it short and sweet. So on the flip side, this long one, there was only about a 5% click-through rate. So for every 100 patients that this was sent to, only 5 of them actually clicked on the link that was provided in this message. So we just wanted to make sure that we were sharing these best practices with you all, so that you can help carve the most effective message to really capture your patient's attention and get that critical information over to them.
And if I could just chime in real fast right there, Paul. Like he said, we do recommend keeping it as short as possible, but I know the last few days I've gotten a bunch of questions from current clients about this specific length. We do normally recommend trying to keep it around 160 characters just because we can see messages getting split up sometimes depending on phone type and carrier. But we do know in this specific situation, we're wanting to include sometimes a little bit more information to make sure we're getting all the necessary information communicated to our patients about COVID-19. So if it is over the recommended 160 characters, it will still send, it will still deliver to patients. It just might be delivered in maybe 2 to 3 text messages instead of 1. So to answer everybody's questions about length, we do recommend keeping it as short as possible, but if it is over 160 characters, it will still send.
Great suggestions, guys. Thank you. So I thought we'd show you just really how kind of quick and easy it is to set up a campaign. So here's just an example. We won't go too far into details, but you can see that basically as you're setting up a campaign, it's as simple as just entering the text information that you like. You can see we've got a very long URL there. Our system actually will shorten that, so it looks much better as it comes across. Another thing you kind of want to keep in mind that we'd recommend is We've seen historically a lot of systems will do the exact same message via text, via call, via email. And so we would encourage you to actually think about, as you're setting up and creating your language, think about how you text with your family and your friends. That's how you want to create your text messages to your patients as well. So short, targeted, precise. A phone call, very different. So you want to, even though you may be sharing the exact same information between a text, a call, and an email, we would encourage you to create those three distinct messages, thinking in mind of how would you send a personal text versus what would you say on the phone versus how would you write an email. We find patients respond much better to that. We all do. We're used to texting, calling, and emailing in different ways. So again, very simple to set this up, very quick. All you do is you grab a CSV list of MRNs or patient numbers. You're going to upload that. You're going to enter your information, and then you basically send it. So depending on how big of the campaign, how many patients there are, is going to determine how long it takes to send. But the actual creation, getting it into the system, you can see is very quick. Not too many more steps in what you're seeing on the screen.
Yeah, and just a quick note on that and all these different pieces of functionality. We do have a support center with articles outlining the exact steps you need to take and providing more information about campaigns, broadcasts, and automations. So if you are a Well community member, you're able to log into support.wellapp.com. You'll have to log in, and then you'll be able to view all of our tip sheets and support articles that actually dive much more into the weeds on actually getting it set up and sent out.
Perfect, thank you. Yeah, and as we go, as Paul said, as you go along, you're going to see some links in there. So those are specifically to our support center. Broadcast. So we showed you the graphic earlier that had the spikes early on around the 4th and I think it was around the 12th or so. Those were the campaigns that went out. Then you can see here that health systems really transitioned to setting up broadcasts, and that's really been the focus now is ongoing broadcasts and then also automations. So broadcast is kind of a stopgap, or for any changing information that needs to be sent out to people coming in that day or maybe the next day, followed by ongoing automations with updated information. Configuration for broadcast, also very, very similar. So setting up a broadcast, campaign, automation, they all kind of look the same, very simple. Again, text, short to the point. Phone call, probably want to identify yourself a little more clearly on a phone call, especially at the top of the phone call. And then we have the ability to do emails as well here. You can see there's a bit of a limitation on broadcast. That's more targeted. You have a cap of 1,000 per day, so a little more targeted message there. Again, a much broader range when it comes to campaigns. Timing. So really we're seeing kind of two different approaches when it comes to the timing of an automation. So again, this might be something going out to all patients with a booked appointment. Regardless, maybe it's confirmed, maybe it's not, but any appointment that's coming up, health systems are typically sending out a message either 4 hours or 25 hours in advance. Kind of two trains of thought on that. So it really is a business decision on your point for your organization to make 4 hours in advance. I find some health systems really want to know, how is that patient feeling today? Do they have a fever today? Do we want them to come in? And the way that works is we send messages within the TCPA hours. So for instance, if it's an 8 o'clock appointment tomorrow morning, that message is going to go out the night before. So still pretty close. Should have a pretty good indication of how that patient's feeling. Whereas some folks are going up to 25 hours in advance with sending messages. They're not combining these cautionary messages or these COVID messages typically with the regular automations, meaning that automations that are already in place, that have been in place for some time, the automations of, patient, you've got an appointment coming up, will you be coming? Those are being left alone. Health systems are creating new and distinct automations specifically for this because they can be updated very easily and quickly without touching the other automations. In fact, what I'm actually seeing over the last 24 hours is some health systems that are, I mentioned earlier, I have a system that is actually asking patients proactively if they will cancel their appointment. So in their case, what they've done is they've turned on this new automation, asking the patients if they would like to proactively cancel, and they've turned off all of their, temporarily turned off all of their appointment reminders. So the only ongoing message is, would you like to cancel? And then some tweaks as to why they're asking that question. So next couple of slides are really about kind of the configuration. Here's an example of an outbound automation. We've actually built this or something very similar to this, and we've placed it in all of our current customers' environments. We've not activated it, but it is there if you're a current Well customer. This should be in your environment today. You're able to make modifications. If you need assistance on activating it, let us know. We'll tell you how to contact us at the end of this webinar. One thing to note is we get a lot of questions about character limit. We have a little icon that turns red if it goes over 160 characters. That's really most important for communities that have a lot of people that don't use smartphones. And there's still a few of those out there. If you've got a community that doesn't have a lot of users on smartphones, probably better to make your automations a little bit shorter. But if that's not a concern, then really smartphones can handle anything over 160 characters. It's still going to send as one bigger message. As you can see here, it kept it as this is over 160 characters, and it went through as one message. Here, multilingual. So we had a question about this earlier. So here's an example of a text message where you can actually add a translation. Our system will automatically translate this for you. Again, we just ask you to have someone that is proficient in that language, verify it, and there's a little checkbox down there you can see that someone has actually verified it. Also, see that little lockbox that we've circled there? So there's really two ways to send out messages through Well. There's either a secure message or a non-secure message. And actually I did see it, there's another question that just came through or a little bit ago about HIPAA compliant communication avenues. So this is actually a good time to talk about that question. Most of our customers are sending most of their automations and broadcasts and so forth as non-secure messages. That just means as long as that little lockbox is not locked, it's just gonna go out like a regular text message. But you may find times where you have information that you want to send to a customer that may have PHI. And you have the ability to do that through Well. Our product is HIPAA compliant as long as you send it as a secure message. What that looks like is a patient's going to receive a text message, a non-secure text message that lets them know, it identifies your health system, that you're sending them an important message, and to please click a link. They are then going to have to self-validate in order to access that link, and then they have access to that secure information. But again, most of our messages, especially this type of stuff, would be going out non-secure.
Yeah, and Rob, just to tack on there with the self-validation, it's very easy. It's very straightforward. Typically, the patient's only going to have to type in their date of birth, and it's as easy as that after clicking in the link to view the message.
Perfect. Thank you, Paul. And here's, as you look over to the right side of the screen, you're going to see call is highlighted. So you probably want to change your language just a little bit versus call versus text. Also, at the bottom of either of these, there's a little phone icon that's grayed out. If you click that, you're actually able to have this automation sent to your phone so you can listen to it because there might be some things you would want to change. I'll give you an example. My chart, which is we usually put as one word, sounds a little strange with an IVR. So if you put a hyphen in between it, it sounds phonetically perfect. And you would only do that on the phone call section. You wouldn't do that on the text section. And we're here to help to configure things like that. Next slide, I think we're going to talk about keywords. So these are the most common inbound keywords that we're seeing people use. So, and really the one that we're seeing the most is fever. So these are inbound keyword automations that we can build, and our next slide is going to show that a little bit more. So health systems are taking all of these words that you're seeing on this screen. They're creating inbound keyword automations that are typically then flagging maybe a clinical group to take a look at these. But there's a couple of different things you could do. You could either have it flag a clinical person, you might have your call center looking for these, and then you can follow up. We can also use automations that if a patient sends in an automation with the word fever, we might respond automatically with an outbound message that's just triggered based upon that says we will have someone call you soon, or maybe something like, please, if you've got a fever, please call us before coming into the clinic.
Yeah, and just to add on there, you saw on the bottom half of the screen a lot of words in Spanish. This isn't limited to just inbound keywords that come in the English language. You can set this up for other languages as well for inbound keywords to set up, automated actions such as tagging in the clinical group like Rob mentioned, or maybe a call center that's on standby to get in touch with these folks. So there is the flexibility and to set this up regardless whether it's English, Spanish, or some of our other languages, so that you can best interact with patients as quickly as possible, and maximizing the efficiency of your staff to focus on really the most critical things that are going on right now.
Thank you, Paul. And this is going to walk us through what it looks like when an inbound keyword comes in. So in this case, what we're going to see is a patient sends in a proactive inbound message. It's got some words in here, right? So fever, coronavirus. So before anybody from your clinic even looks at this or has a chance to see it, if we've got that inbound keyword automation, in this case, maybe it's fever, you can see it says Wellbot up above the blue box. So we've automatically sent out this message back to this patient saying, please give us a call. If you're coming into the clinic, please go to this link. So giving some very specific information. And then I also mentioned that you could do some internal tagging. So for instance, here, this organization has a clinical team that specifically wants to be notified if and when a patient sends in the word fever. So then that gives this clinical team, and it could be, anywhere from one person to however many you like, that's actually able to go and look at this and decide if it's something that they need to take additional action on. As far as building it, so this is just a sample of the build. And we are happy to help you with this, but there's some different ways you can configure this. So you can add, again, within one message that may go out, you can add really as many inbound keywords as you want. So you can see here, this is built off of high fever, COVID, coronaviruses. You've got options of ands and ors. Emma, you do a lot of these. Do you have any additional tips or information when it comes to the building of the inbound keyword automations?
I think you covered most of it. I know with inbound keywords, the really nice thing is they're just really highly, you're able to customize them as you see fit for your practice. So whatever you're seeing your patients text in, you can add in those words to your inbound keyword. So that's why we highly recommend using this, as you're able to customize it to what you're seeing your specific patients text in, and you're able to go in and edit it if you're seeing new words come in that you want to add. So it's a really good way to kind of capture all those inbound messages coming in.
And another thing, so thank you for that. Another thing you can do is, a lot of times we find patients will respond to, maybe they get an appointment reminder that just lets them know they've got an appointment tomorrow and they've confirmed it. And then maybe they just say thanks, or they just say okay. And that typically would leave a channel open. So we can also use these inbound keyword automations to help your staff manage the open channels better. So we can create also, thank you. If a patient sends in thank you, okay, things like this, we can have those automatically close a channel because there are certain words we know that your staff probably doesn't need to take the time to look at. It allows them to be more focused on the messages that are coming in, the channels that are coming in that really do need your focus and your attention. All right, that kind of brings us to our Q&A area. Do we have any questions? Looks like we've got one. Can we speak to providing links to helpful videos in text messages? Yes, absolutely. So we talked a little bit earlier about our ability to send links, and we actually have a built-in, we call it link shortener. It is actually going to shorten any link you can do. So that can be, it could be links to the CDC, it could be to your website, it could be to videos. All of those will be shortened, and we can actually, depending on the type of account you have, we should be able to actually make some of those links look like it comes more from your organization. So we have a lot of things we can do in talking to your support representative. A lot of different things we can do there for you.
Yeah, and Rob, to add on to that, one thing, just in the past few days, what we've been seeing is people putting links to sign up for telehealth visits just to help curb the flow of, people leaving their homes, practicing social distancing and coming into clinics and potentially exposing others. So we're finding a lot of groups sending out links to help sign up and get in touch for video visits so that, patients can still get the care that they're looking for while helping to maintain best practices in terms of just keeping everyone safe during this pandemic.
Absolutely, thank you. All right, if you guys have specific questions, please feel free to send them in. I should have had you do that a little bit ago, but certainly feel free to send in your questions. We're happy to answer any that you have. While you are sending in questions, we've got a couple of email addresses up there. So if you're a current customer and you need assistance or you have questions, feel free to reach out to your client success executive or certainly write support@wellapp.com. If you need help with configurations and so forth, we would ask if it has to do with COVID or the current environment, just in the subject line, if you could just please put COVID webinar in the subject line, that is going to help our team look at those first. And then if there are specific questions for folks that aren't signed up with us and you'd like more information, just email us at well@wellapp.com. And I think we do have some questions. Let me take a look.
Yeah, so Rob and Emma, one other question I saw come in is, how do we send, communication for patients only in a specific town or city? This could be related to a specific clinic closure, and you want to make sure that just those patients that were already on the schedule are getting a message regarding that specific clinic closure. So we do have, as Rob and us have shared today, we do have the broadcast functionality in Well, and you can actually filter down to just a specific location and all the patients on the schedule for that location. So you can send all those patients the same broadcast message in one, quick foul swoop. So a broadcast is really the best way if you've got a specific community of patients, maybe at a specific location, building, or in a specific town. You can use filters within Well on the schedule view, and you can send a broadcast message just to those specific patients. So you're not having to do a bunch of manual outreach. You can just set up one message and select all those patients and have it all send out at once.
And in addition, I don't know if you mentioned this before, our automations can also be set up or configured to only send out to appointments scheduled at specific locations or with specific providers. So if you're looking to send COVID automations only to specific locations or appointments with specific providers, we can do so as well.
All right, thanks everybody. So we really appreciate your participation. I hope that this information has been really helpful. If you have questions, we are here to help you out. We will have a recorded version of the webinar. We'll get that out and available to everybody. Again, if you've got questions, please email us or give us a call. You've got our information. And then if you're, again, interested in learning more about the product, just reach out at wellapp.com. Thanks everybody. Best in health to everyone.